Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, acute PID is treated by IV antibiotics, drainage of tubo-ovarian mass, and laparoscopic exploration. Then, non-gonococcal urethritis is caused by chlamydia. Gonorrhea, which is not a presenting feature. In gonorrhea, discharge is seen and also reddened lips of vulva and vagina are not seen. In gonorrhea, discharge and reddened lips of vulva and vagina are not seen. Acute febrile episodes and hematuria are seen. In gonorrhea, which of the following is not a presenting feature? So, in gonorrhea, which of the following is not a presenting feature? Discharge is present in the gonorrhea. Discharge is definitely present. Acute febrile episodes, hematuria, reddened lips of vulva is present. Acute febrile episode may be present. Actually, hematuria is not present. So here, the hematuria is not present. So the answer here is hematuria. Only hematuria, not the febrile acute episodes may be present.
thank you and thank you for watching.